Well, thank you, Dr. Kinard, for joining us this morning. We appreciate you talking a little bit about your CNE journey. So let's just start out with you telling us a little bit about your journey as a nurse educator. What made you interested in nursing education, and how have you made your path? How you've carved that out for yourself so far?
Well, actually, my growing up, I always knew I wanted to be a teacher or I wanted to be a
Oh,
nurse. And so
mhm,
I ended up going down the path of nursing. And it wasn't until I was going through the DNP program at Duke.
mhm.
And I was presenting, and one of the instructors, the professors, she pulled me aside and said, "Hey, would you be willing to do some work with us on this population health course that's been my kind of specialty area for the last several years?" And I said, sure, I would be happy to. And the next thing I knew, I was um, being mentored and um, kind of groomed to be able to be a lead faculty for this. It was a course, it wasn't offering like credit, but it was
Mhm,
for non-certificate, not degree credit.
mhm.
Um, And so I did that probably about 3 times, got my DNP, and I thought, oh, I really like this. And then from there, I was asked to teach like a course here or a course there for
Mhm,
Duke, asynchronous
mhm.
online. And then Duke offered, it's called the CAMP program. And I'm so sorry, I can't tell you what that acronym stands for, but the whole basis of this CAMP program was to help mentor people like me who are in an adjunct type
Mhm.
faculty role, um, to kind of, with whatever path, whether you decide to stay the adjunct role or if you're trying to transition into full-time academia. So, of course, I said yes. I've always been told by past mentors, if just say yes, like, and see where it goes. And then they started talking to me about this, well, to our whole group about this CNE, this certified nurse educator certification that we could obtain. And I checked, and I had really the minimum number of years. Like, I am still green, I would say. Three
Mhm.
years was the minimum. But I thought, well, what the heck? And so then I spoke with one of the faculty members, and she actually told me, Dr. Sellers, about you. And she said,
Uh-huh.
if you just read this Caputi book and then you listen to some of Dr. Sellers' videos. My style, though, has always been, if I'm going to commit to something, I am going all in. And so then as I
Mhm.
was browsing your website, I'm like, oh, you've got this 60-day boot camp. Oh, I should just go ahead and sign up. So before I even started the boot camp, like, I kind of mapped out, okay, it'll take me 60 days. And then I went ahead and scheduled to take the exam even before I started the boot camp. So I already had
Mhm.
everything kind of all mapped out. And then really the only thing, I had to just trust the process. And so I
Mhm.
trusted your process, Dr. Sellers. And then it was just managing my anxiety and my nerves. And so
Mhm.
then somebody also told me, take advantage of the one-on-one that comes
Mhm.
with the 60-day um, intense like boot camp to prepare
Mhm.
for this exam. So I did that. And that's really, I think, where I got the whew, and then focus on these specific areas. So I really just trusted the process. And then I'm excited.
Mhm.
I passed it on my first time. It was
I
amazing.
know. That's
And
so
now, well,
amazing.
and I just started teaching a course. So this summer I get to teach 2 courses. And the one that just started, um, it's just very different. Like, I love going through a
Mhm.
certification prep process
Mhm.
always, because that's where you just kind of dive in and learn. And so now I'm already applying some of the things.
Yes,
So
that's
that's
so
where I'm at
awesome.
today. So yeah.
That's so awesome. Well, congratulations again, because I know it's no easy feat. And what I love about your story is you were committed. And I think that's where it has to start is each of us, it took me almost 8 years to get CNE off my bucket list because I didn't have the support, I didn't have the guidance. So I think that's such an important part of your story. The fact you reached out to colleagues, you asked for advice, and then you took another really important step, which is figuring out what works best for you because you know yourself better than anybody else. So I really appreciate you saying, you know what? Let me see what else is available. I know the type of learning environment I like to be in. So let me choose the CNE in 60 days option. I love that part of your story because I think some colleagues get stuck because they ask another colleague and they'll tell them what they did and they think, well, that wouldn't work for me, so I'm just not going to do it. I think having alternative paths and individualized journeys is really what helps all educators kind of hear stories and testimonials about other colleagues' journey and how you had to pivot or adjust it to works to what worked well for you. So I think that's amazing. The other important part of your story, Dr. Kinard, is you talked about how you made a decision that you were going to take the CNE exam even before you started, because you tell us, but I would assume that gave you a little bit of extra pressure because you had already started that clock before your initial review journey started. So, talk to us a little bit about how that decision was made and if you felt any kind of additional pressure or stress. I know we talked a little bit about it during our one-on-one, but can you share that a little bit with everybody?
Yeah, sure, I'm happy to. Yeah, I just know that if I don't schedule, like for me, scheduling something
Mm-hmm.
means I'm doing it. And so I had to say
Mm-hmm.
it out loud and then I had to schedule it and then I had to work
Mm-hmm.
backwards. And so by me scheduling was me committing to doing it. I wasn't just jumping in to kind of test the waters and see if this is
Mm-hmm.
something that would be for me. Like it was a real commitment. And then it was, okay, now figure out the right way to study for this thing.
Mm-hmm. Yes. And I remember from our one-on-one, you and I talked a little bit about possibly changing your date. Do you remember that
Oh yeah, I
conversation?
do. I do.
And I think that that's an important part too when we're having those one-on-one conversations with colleagues. We do want it to be a time where you're honest with yourself, where you talk to us about what's bubbling up for you. And I just appreciate you saying, maybe I should change my date. And I said, well, let's have a conversation and then we'll make a decision together. And so after our conversation, I shared with you that you didn't need to change your date, that you were ready. And so I think that mindset piece, as you mentioned, is really important. And then
Totally.
talk to us a little bit about how you celebrate it, because I don't think we celebrate enough. Have you celebrated? And if you have, what did you do to celebrate?
Oh, I feel like I did celebrate. So I
Okay.
had the that weekend
Uh-huh.
following, I was presenting at a conference in Orlando, Florida that Monday, the 27th. And
Mm-hmm.
so see, this is still fresh, y'all, because like we're talking about April, like
I
just
know.
not even a month ago. So I took my daughter and I went like a couple of days early. My daughter's 23, and we
Mhm.
spent the weekend at Universal Studios and just
Oh,
like it was just such a weight that was lifted. It was so great. So yeah, we had a good weekend together, and that was just kind of my way of like, like, so
yeah.
yes, I celebrated.
That's awesome. Well, I'm glad you did celebrate because, like you said, you did the hard work. And I think taking the time to celebrate and really to reflect on how amazing it is that you accomplished a goal that you set for yourself and you use the resources that were going to help you to achieve success. So I think that's an important part too. And then when you think about your next goals, maybe 1 year or 5 years from now, have you given some thought to that? What is that going to look like for you?
Well, I hope to be able to have been involved somehow in curriculum
Mhm.
development or design. I still
Mhm.
very much love my full-time job, so I see myself, I'm still in the adjunct space, but just continuing to work on things like publishing and
Mhm.
presenting. Um, but I actually signed up for the ongoing, I think it's like a monthly boot camp to
Mhm.
maintain CNE because like just
Yes.
so I can continue to learn as I go. But one of the universities I've got courses with now, they allow their adjunct faculty to be part of curriculum development and
Mhm.
design. So I'm really excited about that.
Yeah, and I think that is important as we consider what our goals are, is figuring out what is it that kind of lights us up as it relates to nursing education. I love that you're looking at curriculum because I know there's a lot of work and conversation happening at the professional organization level about curriculum and looking at competency-based model and also with the new essentials coming out, there's lots of alignment that has to be done. And so I think that is a perfect area for you to kind of focus on to think about what your progression is going to look like as a nurse educator.
I,
Excellent.
I
Well,
always see myself in it like that. I don't know
Uh-huh.
yet exactly, when it'll be full time or not, but
Mhm.
yeah, staying in it. And I have applied to do the postgraduate nurse educator certificate through
Oh,
Duke that starts in January.
okay.
I think I kind of did it backwards, but I just really want to continue learning in this space.
Yeah, I think that's great too because that's going to give you even more structure and consistency and the theory. We talk a lot about theory because in our curriculum, all of our programs, we directly align with the actual textbook. And I think that having that structured certificate and you progressing through that curriculum is also just going to strengthen your skills even more. So I think that's a great next step.
And
And
gain such an appreciation. I just have to give a shout out like for faculty, like just there is such theory and time and knowledge and expertise and a skill set that goes into this and that this has also helped me appreciate that even more.
Mm, that's so true because oftentimes, especially when we transition from adjunct to full time, sometimes colleagues can start to feel overwhelmed and wonder if I'm just going through the motion. And I think that your point is very valid in the sense that, which we're going to talk about during our boot camp session today, and that is the power of reflective practice and really taking time to process, okay, why did I choose nursing education? That part that I mentioned earlier about lighting you up really is the glue that causes us to stay in nursing education. I was just talking to some colleagues this week, and we really processed exactly that the fact that, yes, they may be in retirement age. However, they said they still want to give back, they still want to teach, maybe not at the full time level. But I think that we have to just consider what our contributions are going to be to help nursing education progress because we need all colleagues to somehow give back to nursing education as all of us continue to age in our workforce. So that's a great point too. And then any other advice? That was my last question. So you segued that very nicely into the last
Ah,
question. But what other advice do you think is important for colleagues out there that may be listening or watching this testimonial? What advice would you give them if they're thinking about going on that journey to achieve their certification as a nurse educator?
I would say just do it. Like
Mm.
just do it and just try and then find something that works for you. We all know ourselves and what we
Hmm.
need. And I think sorry, I'm not trying to give a sales pitch for your program,
Right,
but
right
it
now.
your program was right for me. And you had
Hmm.
a lot of options. And
Hmm.
so being part of a community like what
Hmm.
which you offer for me works really, really well. But I would just say if you're thinking about it, just do it. Like, what do you have to lose? What do you have to
Hmm.
lose?
Yes, I think that's so important. Thinking about the value that the journey has for you as a person. And that's what we share too. It's important to share testimonials specifically because we want colleagues to hear directly about your experience. You're absolutely right. It's not about a sales pitch. You have to figure out the path that works best for you. However, the most important message is that you can do it too, not to give up, not to get frustrated. Don't look at that pass rate right now. I think NLN reported in 2025 it was 74%. And we know that our philosophy at Dr. Sellars Educate is that we believe all nurse educators should be certified because that helps us really demonstrate to our students that we should progress in our careers and certification is a mark of professionalism. And so having that message come directly from colleagues that have been on this journey is incredibly powerful. All right. Well, thank you so much again, Dr. Kinard. We appreciate your time. And again, congratulations on achieving your CNE. We know you're going to do great things, and we appreciate you joining our boot camp as well.
Thank you.